All right, I'm going to talk today about perception of cine on medical displays. So, of course, we know that small, bright details abound in studies, and that local densities can be significant to a diagnosis. How the moving images are made to be blurry or clear, that's what we're going to be talking about. Now, details obviously should be as bright as possible, but they're darkened if the pixel doesn't change fast enough in a moving image. So we'll talk about that, and then we'll talk about some technology that is used to avoid the introduction of these artifacts on CT and on breast tomosynthesis. So if we look at this about how it affects digital breast tomosynthesis, it's important to understand sort of the nature of what happened when we introduced breast tomosynthesis. We went to having multi-frame image stacks, much larger data sets, and then really a very intensive workflow where people are going to be dynamically browsing through image stacks where before they were just looking at things that were holding still, like the old X-ray film. So the first thing that comes up is the limitation of the liquid crystal display. How fast is its response time? And how does this affect cineing through the multiple images? And then I'll talk a little bit about the detection probability when scrolling through the slices. And finally, the workflow and the time to interpret. This is what we're ultimately trying to do this for, right? Because one of the things that people have observed is that the time went up when looking at 2D mammography exams and moving to 3D mammography exams. And that's something that we're very much working to mitigate. So the desired user experience, right? When someone is using a digital magnifying glass, moving it around, or the spot view feature, they don't want there to be blurring on the display while they're moving. Similarly, they don't want it, when they're looking at a cine, they don't want it to be blurry when the cine is moving. And I think what we have here on this screen here is really showing back and forth now the difference between a blurred image and a sharp image. And that's, we wish that as we were going through it, all of the images appeared sharp. So looking at the LCD response, we have LCD response times, right? People publish these, but they can sometimes be deceiving. They're often talking about what's the speed when going from black to white. But in fact, what we're almost always dealing with in the tomosynthesis cine is going from gray to gray. I mean, it's not very often that something is completely black or completely white. And these numbers are not the same. So the speed of going from black to white, white to black may be one thing, but then going between different gray values may be another. And so if we look at this, if we map out all those different grays, there really are very large variations in the transition times. So if I have the pixel value from the previous frame and then the pixel value from the new frame, you can see that in some cases the response time is very quick, marked here in green, but other times the response time may be very long, multiple frames even. And so this is hidden by what we saw in the previous slide where someone's just quoting what is the resolution, what is the response time when going from black to white, because they're greatly oversimplifying it and they're picking a value which is advantageous. So we don't want to spend 2 to 3 frames to get to the right value because we've in fact already moved on potentially. So the result of it being that way is that's the blurring that we showed earlier. So the subtle details that are in the breast tomosynthesis is really here shown in this moving image, where there's some very subtle calcifications that were represented there. And here it is blown up frame by frame. So when we're scrolling through the stack, the calcifications don't appear in most of these frames, and then for a few frames they appear. And then, of course, as the stack goes on, they're gone. So someone has to pick them up during this period, and they want them to be as clear as possible so that they stand out. So some of the technologies that we use are compensating for this asymmetry and unevenness that causes the blurring during the simi. And then there's another one that has to do with the thermal control to make this better. So I'll go through these a little bit, but the goal is to take this, uneven response time and level that off, and also reduce it as much as possible, so that when you're going from any of the gray values to any of the other gray values, you have a very short response time, and the pixel clearly represents the new frame. So if we look at what are we actually measuring and correcting, so here we are. This is a response time measurement where we're taking in time what is the pixel value. And so here someone has tried to raise the pixel value up to here, but it doesn't get there immediately. It takes a certain amount of time to do that. And similarly, when they're lowering it to a new pixel value that's lower, it also comes down, and then takes a while to get there. So this is the kind of thing that we're measuring on the display system, so that we can determine how much compensation to provide and what to do about it. In terms of, from the perspective of the doctor, they're looking at each frame of the CT or in the Tomo stack, and when the new frame is displayed, the pixel takes a certain amount of time to actually change all the way from where it was to where they're asking it to be. And in this chart, we've mapped that when you're going from the darker part to the brighter to the darker. So then what comes is correction tables. So we can improve these gray to gray response times by having the pixel values change frame by frame in order to improve the slew rate and actually run on this here. This is the slew rate. And if we can get that to go up faster and reach the right value, then it's going to be that much clearer. So we can improve that by having a correction table inside the display. And each unit of the Barco displays is calibrated in the factory with a table that enables the rapid frame feature to deliver a faster response. So then finally, is there anything else that's needed? And that's what I was alluding to, is you really have to have active thermal control. So if we look here in this diagram, this is showing some of the LEDs that are inside a flat panel, and you can see that there's a map of the temperature where the temperature maybe of the LED is 100 degrees C, and then the backlight temperature is 41 degrees C, but you can see that it's varying throughout that. And we really want to have a uniform behavior of the display. We want the response time to be good all over it, not just in one part. And so actually what we do is we introduce things inside the display that make the display very uniform. And so this is showing part of the heatsink assembly from a display, but there's also fans that are turned on and off in order to keep the display at the optimum temperature to get the response time to be fast, in order that the pictures are very clear. So we can think of this also as a kind of temporal uniformity. So it's analogous to our uniformity correction that we do on the screens. And when we go to explain our luminance uniformity, we plot the error of the panel and show how the pixels vary, even though these were all supposed to be the same white level. And the correction of this, which we have done now since 2004 on our breast imaging displays, is really one of the reasons that radiologists prefer the look of the Barco when we show it side by side. But in a similar way, we can plot the error of the display without rapid frame and show how the pixels deviate from the target depending on what they were and what they must become, and how quickly they're going to take to change that way. So here's an example on one of our products, the Neo Fusion, and versus an uncorrected display. And you can see on the left here with rapid frame that it's actually easier to see these details than it is on the image on the right. So how does it matter clinically? So we know that the accuracy of the small object detection can be impaired with the moving images, and the small bright details, are abundant. We want these to be as bright as possible. And so the rapid frame feature, which wouldn't be necessary if everything was holding still because everything would have reached its perfect value. But since the radiologist wants to scroll swiftly, there's plenty of room for improvement. And this is showing from a clinical study that we did what is the impact. So the task here was correct identification of calcifications in breast tomosynthesis. And you see here the ROC curve for that experiment. And maybe just to explain it very briefly, if you look at the ROC curve, it's talking about operating at all different possible amounts of false positives. But if we take a kind of a US-centric view here, we say a typical operating point is to say that 10% of false positives is acceptable for going on for further examination elements. The resulting true positives with rapid frame would be about 75%, but without the rapid frame, it drops down to about 60%. And so this really shows the advantage of having the rapid frame in getting the correct identification of the calcifications when cineing the image. So thank you very much.